Mammograms do not prevent death in women. There are better ways to monitor your breast cancer than mammograms. In this video you will learn how mammograms work and why you shouldn't use them to screen for cancer. You will also learn why mammograms are used to create new cancer patients and not to prevent cancer deaths. And you will also learn 2 other alternative methods you can use to check your cancer without poisoning yourself. Mammography is an X-ray imaging device. The purpose of the device is to make a picture of the breast. During a procedure, the patient undergoing the scan places her breast on a flat plate. Then the operator puts another plate on top called a paddle. On the other side of the device there's a detector, which can either be a photographic film or a digital imaging sensor. To get great pictures you need to compress the breast against the plate. If you don't do it, you might get blurry pictures. During this procedure, the machine produces a small burst of X-rays that pass through the breast to the detector. The detector then produces a black and white picture. On a film mammogram, low-density tissues such as fat appear translucent, and areas of dense tissue such as connective tissue or tumors appear whiter on a gray background. The image that the mammography creates is called a mammogram. In a standard mammogram, they take both a top and side view picture of each breast. After the procedure, a radiologist studies the size, shape and contrast of an abnormal region. They may also look for bits of calcium called microcalcifications. There are many downsides of mammograms. This technology has a problem in detecting cancer in denser breasts. The results are very difficult to interpret since the sensitivity of this technology is uneven. In difficult situations, doctors often combine mammograms with other methods such as ultrasound or MRI. The harms of mammograms are far greater than the benefits. And the sad truth is that this technology doesn't prevent breast cancer deaths. It also creates unnecessary procedures, over-treatment, and exposes you to toxic radiation. Mammograms use ionizing radiation, which destroys DNA and can lead to more cancer. A mammogram involves 4 X-rays, 2 per breast. That exposes you to about 150 times more radiation than a single chest X-ray. And squeezing the breast between 2 plates can also damage small blood vessels. Mammograms don't detect cancers in premenopausal women or breasts with dense tissues. False positives can lead to expensive repeat screenings and cause unnecessary stress on women, which can have a damaging effect on their health. In September 2010, the New England Journal of Medicine published a study about mammograms. The aim of the study was to examine the effectiveness of this treatment. This study said that in 2008, 70,000 cases led to overdiagnosis. This accounted for about 41% of all breast cancer diagnosed. The screenings had at best only a small effect on the breast cancer death rate. Not only are mammograms unsafe, but they are not saving women's lives. Even if you find breast cancer, you will eventually use chemo, radiation and surgery. These treatments are very toxic and can't cure cancer. Chemotherapy is known to be extremely toxic to the body. In an Australian study, they examined thousands of cancer patients for 14 years. These patients used different treatment methods such as chemotherapy. Of those that survived, only 2% could attribute their survival to chemotherapy. Chemo was 0% effective against breast cancer, according to the study. Radiotherapy is also extremely toxic. This technology uses ionizing radiation, which destroys your DNA and causes more cancer. Every time you treat the chest area, you can destroy the heart muscle, which can lead to a heart attack years later. Women that remove their breast don't have higher survival rates than women that undergo breast-conserving surgeries. The worst thing about mammograms are the false positives. A large-scale Swedish study examined the implications of false positive results of mammography. In this study, 60,000 women underwent mammograms. Of those, 726 got diagnosed with breast cancer. And the disturbing fact was that 70% of those women were cancer-free. False positive results were higher in women under 50. Mammograms can also miss some breast cancer cases. 6 to 46% of women with invasive cancer will have a negative mammogram. The risk goes up if they are young or have dense breasts. Every year there's a campaign to make women take mammograms. The Breast Cancer Awareness Month is an annual international health campaign occurring every October. The Breast Cancer Awareness Month started in 1985 in October. It was a partnership between the American Cancer Society and AstraZeneca. AstraZeneca is a British pharmaceutical company that creates cancer drugs. One of those drugs is tamoxifen, which causes more cancer. During the breast cancer awareness event, they don't talk about the cause of cancer or how to prevent it. Susan G. Komen is the largest breast cancer organization in the United States. The organization promotes mammograms as an essential screening tool. The organization says that women should get regular mammograms starting at age 40. The Komen Foundation owns stock in General Electric, which is one of the largest manufacturers of mammography machines in the world. AstraZeneca and pharmaceutical companies have a big presence at Komen Race for the Cure. Komen partners with pharmaceutical companies that create drugs that contribute to more cancer. Despite that women receive mammograms, it doesn't reduce the cancer death. Screenings are only a way for pharmaceutical companies to create new patients. Why would they want to find a cure for cancer when the cancer industry is very profitable? If you want to monitor your cancer, there are two screening methods that are non-toxic and non-invasive. One method is breast ultrasound, which uses sound waves to make a computer picture of the inside of the breast. During this procedure, the operator puts gel on the woman's skin. They then use a transducer to create sound waves inside the breast that echoes back to the transducer. The machine then creates black and white pictures of the inside of the breast. This procedure takes about 20 to 40 minutes to complete. A second way to detect cancer is a technology called mammography. Mammography can detect the first signs of cancer earlier than other diagnostic devices. Mammographic cameras work by detecting radiation that emits from the body. Everything in the universe gives off radiation. As the temperature increases, so does the radiation. When breast cancer cells grow fast, the blood flow increases closer to the tumor, which raises the skin temperature. And in that way you can detect cancer. Mammography is non-invasive, low cost, and doesn't expose the patient to radiation. It's also recommended for women under the age of 50. If you want to learn 13 other ways to monitor your cancer, then download our free document. This guide teaches you how to check your cancer without using toxic methods. I will provide a link to this document below this video. If you like this video, then press the like button and subscribe to this channel. You can also visit our website cancerwisdom.net to learn other natural, non-toxic ways to treat cancer. We have blog posts, courses, and free documents that you can download. Thanks for watching, and I'll see you soon.